Hi everyone, I'm Stephanie, and my project was to teach nurses on my unit about negative pressure wound therapy. Negative pressure wound therapy has been around since the early 1990s and is used to treat patients with acute and chronic complex wounds. These patients can be either inpatient or outpatient. This therapy encourages wounds to heal by applying a localized subatmospheric pressure at the wound site, as well as removing excess fluids that can cause maceration and delay the healing process. This system also helps in reducing edema, bacterial colonization, and helps to trigger the formation of healthy granulation tissue by increasing blood flow to the wound and drawing the wound edges together. Negative pressure wound therapy has been shown to be a safe alternative to other therapies, such as having multiple dressing changes. This system has shown a reduction in healing time, has less risk of infection due to being a closed system, and requires less nursing staff time, as well as expense and shorter hospital stays. The problem within the organization is that there is a gap in practice in the nursing staff with regards to placing a negative pressure wound therapy system on patients at this facility. At this time, there is no longer a wound ostomy continence nurse, and there is a desired need for education to be able to perform this task. From January of this year through August of this year, there have been 49 negative pressure wound therapy systems placed throughout this facility. 26 of these systems have been on one unit. With the wound ostomy continence nurse position being vacant, there is a gap in practice, and during previous absences from this nurse, many nurses have asked for more adequate training. This paper will represent the need for adequate training and the need for management to follow up and ensure that all staff receive the proper training to be able to adequately care for their patients. The stakeholders identified in this project are the organization's patient population that require a negative pressure wound therapy system and the nursing staff. There are other units that could be impacted by these systems if these units are caring for patients that require the use of this system. Wounds requiring negative pressure wound therapy do not always have a common patient. There will be a large number of surgical site infections and wound dehiscence that require the use of this system, but there are also those patients that have difficulties in healing, such as patients with uncontrolled diabetes, and although we do not care for these other patients, the neonatal patient can require this system for a complex abdominal wound that's related to a stoma or fistula that has a partial or complete wound dehiscence of the abdominal fascia or skin. This project will have different education types to ensure that all nursing staff are able to complete the education no matter their learning experience. Both stakeholders may come from different age groups, economic, social, and cultural backgrounds. This project was designed as a way to teach staff with different levels of education and experience the importance of a negative pressure wound therapy system, as well as the application of the system to help bridge the gap in knowledge shown by the nurses on this particular unit. Several theories fit this project, but the one that was chosen was Patricia Benner's nursing theory, which is based on the Dreyfus model of skill acquisition. This model was developed in 1980s by Malcolm Knowles. The theory is appropriate because there are many different levels of education and experience within the unit. The experience on the unit ranges from newly hired or novice to over 40 years of experience, which would be expert. The difference in experience is appropriate for Ms. Brenner's nursing theory. The different levels of experience and education will identify whether the individual is a novice or an expert within their field. The nursing theory identifies 5 levels of experience that a nurse could have. Those are novice, advanced, beginner, competent, proficient, and expert. Someone who has little to no skill, whether it be practical or clinical knowledge, is considered to be a novice. Competencies come with experience. This is obtained through the experience of day-to-day real-life situations, which allow the individual to mature in their ability to think critically. A clinician who is competent in their skills can weed out what is important and not important data in a clinical setting based on past experiences. With every situation, this allows them to learn, and depending on the outcome, gives them experience for the next time a similar situation arises. A clinician that can utilize their knowledge from their experience in the clinical setting with the use of this theory to guide their actions is considered an expert. Negative pressure wound therapy has become more common on the unit where the project was presented. Many of the nurses could be identified as advanced beginner due to the fact that many of the nursing staff have had some experience with the system but have not had the opportunity to actually apply or change one. Commitment to excellence is a nurse's ethical obligation to advocate for their patients. When doing this, shows their peers that they have a leadership quality. An appropriate time to advocate for your patients is when they are suffering with a wound and have to have multiple dressing changes that may cause them discomfort or pain, as well as an emotional or overwhelming feeling of fear. Being able to advocate for your patients does not always mean speaking for them. Showing confidence and competency in the ability to care for them is part of this as well. When staff do not continue to improve their education in order to better care for their patients, they are in direct violation of the American Nurses Association Code of Ethics. There have been many opportunities for nurses to be a part of the application process for this system, but many have had other tasks to complete in order to care for their patients or were simply not interested. The education for this responsibility should not have solely rested on the wound ostomy continence nurse's shoulders, but should have been implemented as a requirement for at least a few nurses on each unit. By not addressing this before it became an actual problem is a direct violation of everything that the Code of Ethics stands for: moral, legal, ethical, and professional obligation. The manager of the education department, as well as the manager of the unit where the education was given, have selected the presenter due to her ability to educate the staff, as well as her experience with the negative pressure wound therapy system. This is considered transformational leadership. The presenter is part of the management team and has a good rapport with not only the staff on her unit, but throughout the facility as well. She has followed the wound ostomy continence nurse and learned how to apply this system, which gave her the experience to be able to educate others. This allowed her to become proficient in her ability to not only apply the system, but educate others as well. Another theory that could be used in this instance is the peer-assisted learning, or PAL. It's peer teaching, which refers to teaching by those who have a similar education background and experience as a student or learners, and where neither the teacher nor the student is a professional teacher. This allows the education to be collaborative and cooperative so both parties can help each other with what they know and the benefits are mutual. The learning outcomes are statements that the presenter writes to show what is expected of the participants to achieve at the end of the education. Outcomes are what is expected of the participant to know, understand, and demonstrate after the presentation. Learning outcomes are usually developed using Bloom's taxonomy. This project provides an innovative solution to the issue of not having the appropriate staff available to change a negative pressure wound therapy system. Many of the staff on the unit, where a majority of these systems are, have seen the system, but have never actually either helped apply it or been there when the application of the system had taken place. Many staff are unaware of how to troubleshoot the system if it alarms, or what is done when the patient comes in with their own from home, or if the patient is being discharged to either their home or a rehabilitation or nursing home facility. This is where information is available from the educator. This information is also available on the facility's Lippincott page, as well as a policy on their intranet, but many of the staff were unaware of this and were surprised to find that there were resources available to them when an actual person was not. This project supports the excellence in nursing practice and patient-centered care, as well as the standards of practice provided by the Nursing Scope and Standard of Practice and the ANA's Code of Ethics. This project expands on the nurses' competencies and duties to maintain their moral, legal, ethical, and professional obligation to their patients as it relates to their practice. All the standards of professional practice and performance were followed and implemented as required. According to the World Health Organization, Nurse Educator Core Competencies and Core Competency 2 states that nurse educators will demonstrate the skills and abilities to design, implement, monitor, and manage curriculum based on sound, contemporary educational models, principles, and best evidence. Core Competency 5 states that nurse educators demonstrate effective communicational skills that promote collaborative, teamwork, and enhanced partnership among healthcare profession, educational, and clinical practice. And lastly, Core Competency 8 explains that nurse educators will demonstrate the skill of system management and leadership to create, maintain, and develop desired nursing programs and shape the future of education institutions. The presenter of the project anticipated the success of the project by being able to observe staff nurses performing the application of a negative pressure wound therapy system, successfully completing a pre- and post-test with improving scores, and the completion of evaluation in order to receive credit for a CEU. What the presenter did not anticipate was that there would be changes to the way staff was able to view their emails. The staff were no longer able to view emails from home due to the increase in the cyber attacks on the medical field. The initial plan was for the staff nurses to receive a link to a pretest once they were signed up for the education. Only 3 staff nurses were able to complete the pretest online due to the changes made to accessing the email. This affected the ability to compare the pre- and post-test results. The project did achieve the outcome that the presenter planned to accomplish, but improvement was needed to get the required staff to attend the presentation, even after multiple presentation times were established to give everyone that was required a chance to attend and adjust their schedule. Below are the predictions of how the outcomes would be achieved. The staff nurses will articulate an increase in confidence on the post-training evaluation. Staff nurses will score 80% or greater on the post-test. They would complete a presenter evaluation form. They will show competency during hands-on demonstration. The pre- and post-test both consisted of 6 questions, and the results were entered into a spreadsheet, and the answers are depicted in the results provided. 3 staff members were able to complete the pretest, and only 1 nurse received 100 on the test. The other 2 nurses each missed a question, giving them an 83% on the pretest. 11 staff nurses attended the presentation at different times, and out of the 11 nurses, only 2 questions were answered incorrectly in the post-test results. These were 2 questions by 2 different nurses, both giving them an 83%. The one nurse that missed a question in the pretest improved her score on the post-test by receiving 100, whereas the other nurse answered the same question wrong both times. The first 3 outcomes were demonstrated during and after the presentation by the nurses filling out the evaluation form and being able to explain the proper techniques of applying this system on a mannequin. Further evaluation will be done when applying this system on an actual patient multiple times until the nurse feels confident to do it without the educator. Once this competency is achieved, the competency form will be signed and applied to the nurse's file. According to Martindale 2012, clinical staff must be able to be prepared to closely monitor, properly apply, and effectively be able to troubleshoot the machines, as well as recognize and respond to complications in the negative pressure wound therapy system in order to properly care for their patients. The nursing staff had requested this education in the past due to circumstances of the wound ostomy continence nurse being away from the facility for whatever reason, leaving the nurse to feel incompetent in caring for their patient with a system. According to Delmar 2020, the lack of nursing knowledge can lead to practice issues, poor patient outcomes, and negative reimbursement, as well as the possibility of legal issues in the future. In conclusion, a negative pressure wound therapy system is a treatment for acute and chronic wounds that uses a gauze dressing that is placed into an open wound and sealed with an adhesive film that is connected to a tube, which is embedded into the dressing and attached to a vacuum pump, which creates negative pressure to the wound site. There was a gap in knowledge of the application of this system and a request from nursing staff to acquire more education to be able to manage these systems for their patients. Although there was some hesitancy about the time that is required to manage these systems, along with the lack of knowledge, but evidence from the post-test and evaluation showed that the education was beneficial, and with continuing education through competencies, nurses will be able to apply these systems on their own and manage them when issues arise with confidence and a feeling of competence. The benefit to the organization is that by having more competent nurses, there is less risk of patient dissatisfaction in relation to wound care. Educating the staff and giving them the knowledge to educate their patients is beneficial not only to the organization, but the patient as well. Providing this education through a hands-on and required competency allows the education to continue, and this project accomplishes this goal.